Good morning, welcome to Breakfast with Naga Chetty and Charlie State.
Our headlines today. After weeks of tension, the UK and EU edge closer to resolving a row over vaccine supplies.
I know that there's some tension, of course, which is normal, but as long as we will have transparency and as we will be able to understand, I think things will be able to be normalised.
Pub landlords could be allowed to ask customers for proof they've been vaccinated before allowing them into their premises.
What's the future for cash? Good morning. The new £50 note will be revealed on Breakfast later, but millions of us are living virtually cash-free. We look at what's on the new note and why it matters.
Good morning from me and from Tom, Jerry and Ben, 3 alpacas who live in the heart of London. And for 50 years, city farms have been bringing wildlife into urban areas. During the pandemic, they've been doing a lot more as well. We'll have more a little later.
Good morning. It's defeat for Wales in the end in their first World Cup qualifier, but they did take the lead, but then Belgium were just too strong, with Kevin De Bruyne on target for the #1 ranked team in the world.
Good morning. For the next few days, we're looking at sunshine and showers. As it's going to be colder tomorrow, some of the showers will be wintry, mostly on higher ground, and at times it's also going to be windy. But I'll have all the details coming up later in the programme.
Good morning. It's Thursday, the 25th of March. Our top story is that the UK and the European Union have taken a step towards resolving a dispute over access to Covid vaccines as EU leaders prepare to vote on controversial plans to restrict exports.
The two sides say they're working on a win-win solution after the EU blamed its slow rollout on the pharmaceutical firm AstraZeneca not delivering enough doses. Our correspondent John Donnison has more.
The vaccine row between the UK and the EU has been rumbling on for months. But it's intensified, with many countries on the continent now facing a third wave amid concerns over vaccine supply and a slow rollout of the jab. In a joint statement last night, the EU and the UK said they were working on ways to better cooperate over vaccines. So could an end to the acrimony be in sight?
This is very positive news. What we want to see is we want to see vaccines flowing freely around the world. We want to work to build capacity so that we can make sure that everybody gets vaccinated, including the UK, the EU, and of course many developing countries, because we're only going to tackle coronavirus by making sure everybody gets vaccinated. So this is a very positive step forward.
EU leaders will meet via video conference today to discuss ways of boosting vaccine supplies and possible new restrictions on vaccine exports, including doses of the AstraZeneca jab, which could impact the UK.
The point is AstraZeneca is fulfilling its contracts in the UK and is not fulfilling its contracts in the European Union. And they are exporting vaccination material from the EU to the UK and not fulfilling the duties that they have within the European Union. And I think it's just natural that the European Union has to react to this.
But some health officials have accused European leaders of sending out confusing messages over AstraZeneca by questioning the vaccine's efficiency and safety, which has led to poor uptake of the jab on the continent. With many EU voters angry at their governments over ongoing lockdowns and frustrated with vaccine rollouts that lag far behind the UK, there is a political blame game underway.
You cannot wrap a flag around a vaccine in this modern world. It just doesn't work that way. These are integrated supply chains, and any attempt to impose any barriers whatsoever will disadvantage everybody involved.
In other words, so-called vaccine nationalism might be understandable, but not helpful, with a pandemic that's global. John Donnison, BBC News.
Pub landlords could be allowed to refuse entry to customers who can't prove they've had a coronavirus vaccine. A review is looking into the measure as the lockdown is eased, and the Prime Minister said the decision could be left to individual landlords. Some Conservative MPs have criticised the idea, with one calling it a ghastly trap.
NHS England is urging the over 50s and anyone in the vaccine priority groups to book their Covid jab before expected delays in supply. The National Medical Director, Professor Stephen Powis, says anyone who qualifies for a vaccine but hasn't yet received a first dose should book an appointment in the next few days. Vaccine supply will slow down in April, meaning efforts will then focus on delivering second doses.
Scientists have launched a study to see if two drugs which are already available could be used to reduce deaths from so-called long COVID.
The Cambridge-led trial also aims to cut the number of people who are readmitted to hospital following treatment for coronavirus. Our science correspondent Richard Westcott has more.
COVID has put nearly 500,000 UK people in hospital so far. Most survive, but the disease doesn't relinquish its grip just because they've been discharged. Ambulance driver Nigel's been nicknamed the Miracle Man by his doctors after nearly dying from the disease last summer.
3 cheers for Nigel! Hip hip! Hooray! Hip hip! Hooray! Hip hip! Hooray!
Leaving hospital was a high point, but months later, he's still suffering.
Can't walk very far, but I do my best. Upper body strength, where I used to have that, I haven't got that anymore.
You tire easy, don't you?
I tire,
have an
yeah.
afternoon nap.
Yeah.
You've got your stomach problem.
Yeah, ulcerative colitis.
Yeah, the mental health PTSD side of it.
Yeah.
Mood swings.
Yeah.
I had COVID. I still have the loss of smell, but to me, that's nothing. I don't class that as long COVID. That's just how it is. This is long COVID because it's affecting his life.
This increasingly common long-term damage is why Cambridge researchers are launching a new UK-wide drugs trial. Led by a doctor who pushed through all the paperwork and raised the money in between shifts on intensive care.
Hi Charlotte, how are you?
I'm well, thank you.
They'll be recruiting discharged patients to try two common drugs.
The apixaban drug is a clot-busting drug, and we know that people who have coronavirus infection are at increased risk of getting blood clots in their lungs and their legs. So it's to try and target that in the post-hospital phase. And then atorvastatin is a cholesterol-lowering drug. One of the really important things about these two particular drugs is they're relatively cheap, they're easy to take because they're tablets, and they're widely available.
A large study found that for every 10 people discharged from hospital after COVID, within 6 months, 3 will be readmitted and 1 will die. Finding treatments to cut those numbers could change thousands of lives. Richard Westcott, BBC News, Clacton in Essex.
NHS staff in Scotland are to be offered a pay rise of at least 4%. The Scottish Government confirmed that nurses, paramedics and domestic staff are among those who could receive the boost to their salaries. Earlier this month, Prime Minister Boris Johnson defended plans to give some NHS staff in England a 1% increase.
The National Stalking Helpline says it's seen a 10% increase in calls since the pandemic began, with around 20,000 people contacting the charity over the past year.
Many have reported cyberstalking and the use of tracking devices. One victim has been speaking to the BBC's Emma Glasby.
I'm never somebody that suffered from anxiety. It's not something that's impacted me, but it crippled me at times. I felt incredibly vulnerable. I live remotely and I'm on my own. I just lived every day wondering what they might be capable of next.
When she ended her relationship, her ex refused to accept it. Becky, not her real name, was then bombarded with messages and made to feel like a prisoner in her home.
I just kept seeing him everywhere that I went. I was driving along the road. He would nearly always be coming in the opposite direction. If I left the gym, he would be outside driving past.
She took her car to the garage and a mechanic discovered a tracker device fitted underneath.
I started shaking. I knew immediately that it was him. All of those events just fell into place. How he knew where I was.
In the crime survey for England and Wales, 1 in 20 women and 1 in 50 men said they'd experienced stalking in the past year. The National Stalking Helpline has seen a 10% increase in calls since the pandemic began, with almost 20,000 people contacting the charity since the first lockdown.
Victims have explained to us how they feel like sitting ducks, waiting for an incident to occur because they're not able to do normal things that they might do every day, like varying their routines. And particularly that cyber stalking component of this invasion of every facet of their lives. And that's something, that trauma that they've experienced during the lockdown, that we're going to be supporting them with, unfortunately, for some time to come.
Becky's stalker pleaded guilty in January and was jailed for 2.5 years. But it's an ordeal that's left a lasting impact on her business, her friendships, and her sense of feeling safe and secure. Emma Glasby, BBC News.
See the headlines as they happen and watch BBC News live in the app and get the full story with bbc.co.uk/news. Follow the story for all the latest with BBC News.